Assalamualaikum warahmatullahi wabarakatuh, and very good day to everybody in International Conference on Advanced Social Research in Education, Management and Society 2023. I am Norsuraya Hassan from University Technology Mara, Cawangan Pulau Pinang Campus Pertama. And today, I would like to present my studies, and it's all about the association of demographic characteristic with confidence level and perceived barriers to involvement in palliative care among critical care nurses. And again, I am Nusrai Hassan, and this is all my team members. So this is my presentation outline. So, palliative care management is an approach to improving the quality of life of patients and their families facing the problem associated with a life-threatening illness through the prevention and relief of suffering through early identification, impeccable assessment, and treatment of pain and other issues such as physical, psychosocial, and spiritual. So, healthcare practitioners should be able to offer adequate palliative care and through palliative care treatment meet the needs of patients and their families. So, nurses are essential to delivery of palliative care, and nurses' expertise in clinical care is vital to maintaining a high quality care. There is a consensus that a lack of knowledge and education is a common barrier uh, to quality treatment. This is according to Swakali Zelenin et al. 2020. So, as in a slide, this is some of my literature review. So the problem statement for this study is in Malaysia, there is no many studies were done and published regarding the confidence level and barrier to nurses' involvement in palliative care for end-of-life patient in the critical care unit. So this study will produce evidence for nurses in Malaysia to take or plan an active action to help raise nurses' level of self-confidence in participating in palliative care. And also, it can also help policymakers to find strategies to enhance nurses' communication and involvement to improve health services. And the research objective for this study is to determine the association between confidence levels and the various nurses perceived to their involvement in palliative care with demographic characteristics. So this is some of the methodology of this study. This study using non-experimental cross-sectional quantitative study. The sample are among the registered nurses in the General Intensive Care Unit (GICU), Coronary Care Unit (CCU), Pediatric Intensive Care Unit (PICU), and Neuro Intensive Care Unit (NSU) in Penang General Hospital. And the total sample size in this study is 157 respondents. We are using non-probability convenience sampling, and inclusion criteria for this study is the nurses must be in critical care unit with at least 6 months of experience. In this study, we are using a self-administered structured questionnaire, which is Impact ICU, that we adapted from Anderson et al. 2016. And data analysis used in this study is descriptive statistic and chi-square. As for the result of this study, okay, according to this table 1, okay, the socio-demographic characteristic of these critical care nurses were showed in frequency and percentage and were present in this table 1. So 157 nurses were eligible to take part in this study. So they are consisting of critical care nurses working in ICU, which is GICU, CCU, NICU, and PICU. Okay, so in this study, a total of 115 nurses was completed the questionnaire, and the response rate for this study is 100%. So in this table showed that 78 of the participant age was within range of 20 to 30 years, and 75 of them aged within 31 to 40 years, while only 4 of them aged within 41 to 50 years old. So most of them were female, while only 17 of them were male nurses. Most of them had a diploma in nursing, while there are 4 nurses who had degree in nursing. Okay, more than half had 1 to 9 years experience in nursing, which is consists of 66.9% of them. 49 had working experience between 10 to 19 years, while 3 of the nurses had experience in the nursing profession between 20 to 29 years. So as their experiences working in intensive care unit, 59 of the participants had only 1 year experience in critical care nursing, and 73 of them had 2 years working experience. 19 of them had 3 years working experience, while 5 of them had 4 years working experience, and only one had 6 years working experience in intensive care unit. Half of the participants involved in this study were from the ICU, 26 of them from PICU, and also 26 of them from CCU, and another 25 of them were from NICU. As for the table 2, it shows that the result for nurses' confidence level in the performing palliative nursing. So the participant revealed that they were very confident in identifying the family needs for information of patient care and treatment, which is they are very confident, uh, and the percentage is 20.4%. So identifying, they also very confident in identifying and responding to family members' emotional distress, which is 15.9%, very confident, and assessing for family discussion needed uh, is 15.9% confident. Then, while 13 of them claimed that they were not confident in an active contributing participant in family meeting, and also obtain information from physician to understand of patient goals of care, and they also not confident to communicate the value of consultation to physician. Table 3 shows the various nurses perceived to their involvement in palliative care. So as we can see in this table, there were 5 choices of nurses perceived to their involvement in palliative care discussions, which is strongly disagree, neutral, agree, and strongly agree. So most of the participants strongly agreed that they need more training in palliative care, and 43.3% of them agreed and strongly agreed that the physician do not ask for the perspective in palliative care. 62 of them agreed and strongly agreed that their involvement in palliative care discussion was emotionally exhausted, while 61 of them agreed and strongly agreed that it was hard to get coverage for their patients, so they can't attend family meeting as the most perceived barrier to their involvement in palliative care discussions. However, most of them were disagreed, which is they score for strongly disagreed, and neutral, that the statement of they do not have time for bedside discussion of prognosis. Um, 146 of them scored disagree, and they also disagreed that their managers do not support the involvement in the discussion. Okay, and they also disagree that the physician have negative reaction to palliative care as their perceived barrier to the involvement in palliative care discussion. And finally, in this study showed that there was no significant association between the level of confidence in performing palliative nursing with the demographic characteristic of the participant. However, as we can see in table 4, um, This study found that there was statistically significant association between the barriers nurse perceived to their involvement in palliative care with the demographic characteristic of the participant, with the p-value less than 0.05. So the perception of a barrier that significantly associated with the demographic characteristic of the participant, uh, the perception of the physician had a negative reaction to palliative care with the participant age. Okay, there is an association. Okay, so another association is a family have negative reaction to palliative care with their years of working in intensive care unit, and also the association of the perception of hard to get coverage for their patient, so they cannot attend family meeting with the years of services, and also the association of their years of working in intensive care unit and their perception that they did not have time to attend family meeting with their years of services. So for the discussion, the study showed that critical care nurses who are younger tend to face a barrier in engaging in palliative care compared to older staff. This is also closely related to the experience and knowledge that influence an individual's attitude and skills. So this is in line with Nelson et al. 2010, where the author indicates that the age and gender or other characteristics can affect some palliative care attitudes. Various participants in this study who had encountered ICU management over a long period of time expressed broad agreement in this environment on important aspects of palliative care. So according to Famani et al. 2018, also agree that what and level of education had a significant association with participating nurses' practice towards palliative care. So the nurses who working in intensive care unit had better participating in practice toward palliative care. And also from Kayot et al., Kayot A et al. 2018 found that adequate nurses staffing and nursing organizational manager support are essential to enhancing the quality of patient care, minimizing frustration and burning out of nursing work, and eventually improving nurse retention in hospital setting. So this is the highlight that the facts that sufficient human resources are important to the success of healthcare delivery. So as for the conclusion, critical care nurses can facilitate palliative care by collaborating with other healthcare providers to determine the precise unit requirements for patient referral and by ensuring that only the appropriate patients are referred. And palliative care is more likely to be incorporated into critical care if nurses regularly advocate for it and educate the critical care team about it and its benefits. So because they can do all of these things routinely, critical care nurses will become palliative care champions. So I think that's all from me. Thank you for listening and have a nice day. Thank you.